day, viewers, and welcome to DDM Health News Updates under the program Your Health, Your Wealth. Today, we'll dive into a subject often surrounded by myths and misconceptions: penis size and its impact on sexual function and fertility. Contrary to popular belief, medical experts and clinical sexologists affirm that penis size has little or to no significant effect on male fertility or sexual performance. Instead, factors such as hormonal balance, sperm quality, and overall health play a far more crucial role. Clinical sexologist Cecilia Go emphasizes that societal pressure and media influence often exaggerates the importance of size, leading to unnecessary concerns among men. She explains that sexual satisfaction is not determined by size alone, but rather by emotional connection, chemistry, and creativity in the bedroom. For many women, what truly enhances intimacy is the quality of connection with their partner, the level of trust and mutual understanding. Argo states, size is rarely the determining factor for pleasure. Instead of fixating on measurements, men should focus on fostering a strong emotional and physical bond with their partner. She also points out the cultural influences, historical myths, and modern media, including pornography, have reinforced the misguided notion that bigger is better. This perception, she adds, has been commercially exploited by industries selling aphrodisiac and so-called enhancement products. Addressing medical concerns, Argo clarifies that while conditions such as micropenis, often linked to hormonal imbalances, do exist, they are rare. If any concerns arise, seeking professional medical advice is the best course of action. Meanwhile, consultant urologist Dr. Gabriel Oga displays any link between penis size and male fertility, stating unequivocally that reproductive capability is determined by sperm quality, not size. The man's ability to conceive a child depends on healthy sperm production, not the length or girth of his penis, Dr. Oga explains. Even individuals with smaller than average size can father children as long as their reproductive system is functioning normally. He further notes that any men who perceive their size as inadequate actually fall within the normal range. He attributes this rising concern to increasing exposure to unrealistic portrayals in adult content, which fosters unnecessary anxiety and self-doubt. The demand for enlargement solution is at an all-time high, even among elderly men, he remarks. Yet, in clinical practice, we find that most of these concerns stems from micro misconceptions rather than medical realities. Ultimately, the takeaway from experts is clear. When it comes to sexual satisfaction and fertility, size is not the defining factor. Instead, overall health, emotional intimacy, and self-confidence are what truly matters. Next, in a move sparkling outrage among healthcare professionals, the Guide of Medical Directors, GMD, has strongly criticized the Lagos State Parking Authority decision to impose parking fees on private hospitals. Medical experts argue that the policy amounts to overtaxation, which will inevitably lead to increased healthcare costs for patients. The controversy erupted after a private eye hospital in Ikeja received a payment advice 2025 bill amounted to 40,000 naira for a single parking space within its premises. For 6 parking slots, the total annual levy reached 240,000 naira. The Guide of Medical Directors, led by its president, Dr. Raymond Kuti, is now calling on the Lagos State government to revoke the charges, emphasizing that healthcare facilities should not be burdened with the same financial obligations as commercial enterprises. According to Dr. Kuti, this is an unprecedented move, as hospitals have never been mandated to pay for parking spaces in front of their premises. He warned that the added financial strain would ultimately be transferred to patients, exacerbating the already high cost of healthcare. He likened the situation in imposing similar charges on schools and fire stations, both of which provide essential social services. His concerns were echoed by the Lagos State branch of the Association of Nigerian Private Medical Practitioners, whose chairman, Dr. Jonathan Esegini, lamented the increasing regulatory and financial pressures on private medical facilities. He pointed to the existing burden of multiple taxation and stringent licensing requirements, which he argued were stifling efficiency and making it difficult for doctors to focus on patient care. In defense of the policy, Lagos State Commissioner for Information and Strategy, Winga Omotosho, maintained that private hospitals as commercial entities should be subject to parking fees like other businesses. He explained that many private hospitals occupy government test bags, which require state maintenance. Omotosho further asserted that parking fees were previously collected by local governments before the establishment of the Lagos State Parking Authority, LASPA. He added that similar charges are applied to visitors at state-owned general hospitals. The debate underscored the broader concerns of healthcare accessibility and affordability in Lagos State. With medical professionals warning of dire consequences for patients and the government standing firm on its revenue generation policies, the fate of this parking levy remains uncertain. The question now is, will the state government reconsider, or will private hospitals and their patients bear yet another financial burden? We can't tell. Up next, in a distressing revelation, the president of the Association of Nigerian Resident Doctors, NAD, Dr. Tope Oshudara, has sounded the alarm over the deteriorating state of medical infrastructure in public hospitals across Nigeria. At the heart of the crisis of the erratic power supply, which has rendered critical diagnostic equipment such as a magnetic resonance imaging, MRI, and computed tomography, CT scanners, largely non-functionally. Speaking exclusively to a printed media organization, Healthwise, Dr. Shundara emphasized that while some hospitals have turned to solar energy as an alternative, the sheer power demands of advanced medical equipment far exceed the capabilities of solar solutions. MRI and CT scanner, he explained, require a stable and uninterrupted power supply, both to function effectively and to prevent costly damage to their patients' demands. Unfortunately, the prevailing electricity challenges in public healthcare institutions have made this nearly impossible, forcing many Nigerians to seek these essential diagnostic services in private facilities at exorbitant cost. Beyond imaging technology, the power crisis has also crippled laboratory operations in many hospitals, further compounding delays in medical diagnosis and patient care. According to Dr. Oshundara, healthcare workers often find themselves waiting for power to be restored before conducting essential tests, inefficiency that proves detrimental, particularly in emergency situations. The situation is there, he lamented. In some of our hospitals, power is so unreliable that laboratory samples must be pulled together and tested only when electricity is available. This creates significant delays, increasing patient suffering, and undermines the very essence of an effective healthcare system. Describing the state of public hospitals as an unacceptable setback for Nigeria's healthcare sector, Dr. Shundara called for urgent reforms. He stressed the need for medical institutions to become more self-sufficient in power generation, drawing parallels with some universities that have successfully implemented independent electricity solutions. If institutions like Confidence University and Regimas University can generate their own electricity, what is stopping us, our major hospitals, from doing the same? He questioned. Teaching hospitals like the University College Hospital, UCH, in Ibadan should be leading the charge in this regard. The recent power challenges at UCH were not just an embarrassment, but a tragic blow to healthcare in Nigeria and across Africa. While acknowledging that solar power offers a temporary respite, Dr. Shundara reiterated that insufficient for high-energy medical devices. Instead, he urged healthcare policymakers to explore long-term power generation solutions tailored specifically for hospitals, emphasizing that a reliable electricity supply is not just a luxury, but a fundamental requirement for modern medicine. As Nigeria grapples with its ongoing electricity crisis, the health sector remains one of its most vulnerable casualties. Without urgent intervention, the dream of accessible and efficient public health care could remain just that, a dream. Finally, in a concerted effort to addressing Nigerians' alarming maternal mortality and stillbirth rates, leading maternal health experts are emphasizing the urgent need for data-driven interventions. Their call to action underscores the importance of accurate data collection in shaping effective policies and healthcare strategies. Speaking at the Lagos State Verbal and Social Autopsy Sample Registration Center project meetings, stakeholders highlighted the significant gap in maternal death documentation, stressing that without precise data, meaningful progress remains elusive. The Lavasa SRS initiative, a collaborative effort between researchers, the Lagos State government, and the key partners, aims to generate reliable estimates of maternal mortality and stillbirths. This insight, experts say, will provide a solid foundation for targeted, impactful healthcare reforms. Professor Adurabwemi Banke Thomas, a distinguished maternal and newborn health expert from the London School of Hygiene and Tropical Medicine, underscored the critical role of robust data in driving sustainable change. As the co-principal investigator and strategy lead for Lavasa SRS, he emphasized that the initiative is not merely about gathering statistics, but about translating findings into actionable policies that save lives. For the past years, we have been meticulously collecting data to map out maternal mortality trends in Lagos State. Professor Banke Thomas revealed, this summit serves as a crucial platform to review our findings, engage policymakers, and ensure that our research translates into concrete, life-saving interventions. Crucially, the project extends beyond hospital records, capturing maternal deaths occurring within communities, incidents that often go undocumented. Funded by the Gates Foundation, the initiative has mobilized local actors to gather critical insight from families and relatives, shedding light on the underlying causes of these tragedies. Adding to the discourse, consultant gynecologist Dr. Donald Imosemi, chairman of the Lagos State Steering Committee of Prematernal and Child Death Surveillance and Response, reiterated the pressing need for precise evidence-based approaches. He stressed that without a clear understanding of maternal mortality root causes, interventions would lack the precision necessary to be truly effective. The strength of any healthcare system is measured by how well it safeguards its most vulnerable, mothers and children, Dr. Imosemi stated. Lagos has made commendable strides, ranking 8th in Africa for healthcare quality. However, we are far from satisfied. Our goal is to climb even higher, ensuring that every mother receives the care she deserves. With approximately 60% of Lagos healthcare services provided by the private sector, experts also underscore the need for stronger collaboration between public and private healthcare providers. Engaging all stakeholders, they argued, is vital to tackling maternal mortality comprehensively. Dr. Imosemi further highlighted that the majority of maternal death occurs at the community level, often outside the purview of formal healthcare facilities. This underscores the necessity of strengthening grassroots health systems to improve early interventions and prevent avoidable deaths. When maternal deaths go unrecorded, we lose valuable insights that could drive effective policy changes, he explained. By ensuring comprehensive data collection at the community levels, we can direct resources where they are needed most and ultimately save lives. The Lavasa SRL's project, which brings together experts from Lagos State University Teaching Hospital, the Ministry of Innovation, Science and Technology, and various government ministries, represents a bold step towards transforming maternal health care in Lagos State. Supported by the African Population and Health Research Center and the London School of Hygiene and Tropical Medicine, the initiative is poised to deliver groundbreaking findings that could reshape Nigeria's maternal health landscape. As discussion continues, one message remains clear. Data is not just numbers. It is the key to safeguarding the lives of women and newborns across Nigeria. Well, Stay tuned as we bring you more updates on this critical issue. Bye for now. I am Nenyo Michael Inezini, and please don't forget to like, share, subscribe to our YouTube channel, Diaspora Digital Media. Until next time, I am Nenyo Michael Inezini. Bye for now.